Hi, everyone, and welcome to the AIHM Wellness Webinar. Today, we have a very special guest, Dr. Bradley Jacobs, and we're really excited to have him. And I just wanted to welcome you all and just take a moment to take a breath with our integrative community. It's been a week, and we're looking forward to a long weekend here, our first holiday at home stay weekend. So just a quick disclaimer, the contents of this video are for informational purposes only and are not a substitute for professional medical advice, diagnosis, or treatment. Please always seek the advice of your physician or other qualified healthcare provider with any questions you have regarding a medical condition and before undertaking any diet, dietary supplement, exercise, or other health program. Neither AIHM or featured practitioners are responsible for any adverse effects resulting from your use or reliance on any information contained in any video. And these videos really are designed for our licensed clinicians and practitioners in our community. And so we're really excited to be connecting with all of you. The Academy of Integrative Health and Medicine is a global interprofessional integrative health association working to transform healthcare, body, mind, spirit, community, and planet. And we hope that you join our community as we are growing every day. And our mission is to really bring all of us together and continue to put forward research and education and build our community and create a person-centered integrative healthcare system. So today, I'm really just so privileged to have the opportunity to present our past board chair, Dr. Bradley Jacobs. Brad graduated from Stanford School of Medicine and is a medical doctor there. He went to the University of California, San Francisco, where he did his internal medicine residency and clinical fellowship. He is an American Board of Integrative Holistic Medicine diplomate, as well as an American Board of Integrative Medicine diplomate. He is an endowed chair and founding medical director for the UCSF Osher Center for Integrative Medicine, co-founded several health IT companies that focus on disintermediating healthcare delivery and research to provide consumers direct access to care and research. He's authored many scientific articles and co-authored the American College of Physicians Evidence-Based Guide to CAM, as well as the Anti-Inflammation Cookbook. He's a current board member and past board chair for the Academy of Integrative Health and Medicine, and he lives in the San Francisco Bay Area, where he runs a concierge integrative primary care practice, Blue Wave Medicine, which is located within the national park. He co-founded Humankind Now, which is a 501c3 focused on procuring PPE for healthcare workers and first responders. And it really is a pleasure to have you here today, Brad, just to be talking with our community about what you've been working on and you know, how you can give us some tools to really kind of help manage everything that's happening with COVID in our community. So I will turn it over to you. I'm going to stop my share here.
Thanks for having me, Tabby.
Yeah. And thank you all for coming in from all over the world and joining us every week. Please feel free to put your comments in chat with us during the presentations. And if you have any specific questions for Dr. Brad, please put them in the Q&A section, and he'll be taking questions as we go through and at the end.
Terrific. Great. Can you guys see the slides okay? Great. Well, I want to, let me just stop sharing for a moment and just say, you know, it's great to be here, Tabby. It's so nice to be able to join this event, and thank you for hosting it and putting all the energy that you have, and same for the Academy for Integrative Health and Medicine. It's really an honor to serve on the board, and I'm so delighted to be able to be part of the journey as we transition into our next phase of growth at the Academy, and as a community of integrative medicine and health practitioners come together and reimagine what we can do together to really make the world a better place and to help move ourselves from a surviving mode to a thriving mode. I think, best done in community, best done in collaboration. It's a little bit different now because we find ourselves doing it virtually and with less sort of hugging, and which we all love to hug, at least many of us do. So it's sort of finding a new path. And I thought I'd try and speak to that a little bit today. And I'd love to get some feedback. And if people can put their questions in the Q&A side as we go through, maybe we can address those in real time or towards the backside. So I thought I'd walk through a few slides that sort of just set up a bit of the perspective of where at least I view things are and moving forward, and just thinking about how we might reimagine where we're going towards. So let me just share that with you. Here are some slides. So, I feel like there's a lot going on out there.
Brad, if you want to just put it into full screen, and then it will fill up your screen because we can see a little bit of your desktop, not much.
Let's see. Thought I wasn't full screen. Okay, that's my full screen. Is that working? So in thinking about sort of, there's a lot going on, emotions are really running high. And I think people, are seeing each other from very different places. We have people that are armed, standing in front of tattoo parlors and hairdressers. And we have people with masks that are very concerned about themselves or their family members becoming infected. I think the one thing we can all share is at the emotional level, there's a lot of fear. And I think recognizing our commonality and our fear is really important, and allows us to come together around something that we all share, rather than these people are worried they're going to be bankrupt and be hungry and homeless, and these people are worried they're going to be sick. And I think we're all worried about all of it, and it's just manifesting in divisive ways, partly as a result of the leadership at the national level, unfortunately. But if we can sort of on both sides of the equations come together and find our commonality, I think it would help us. I know that when I sort of bump into people that are very afraid, and I'm quick to sort of judge, and I'm finding myself, my daily practice is to pause before I react, is to really do my best to pause and not react with sort of high emotion. And I invite you to do the same. So the part of that is a journey today, is to sort of just explore that space. What does that feel like? What does that look like? And to find some time in your day, just every day, just check in with yourself, and know that you'll probably bump into people or see news that's coming at you that's going to raise those emotions in us. And so I welcome you to sort of check in with that, sit with that every day, and start to observe it and see if you have, if it allows you to sort of free up your mind so that you can choose how you want to respond rather than just responding. And so, there's, I think there's a full range of experiences, and what's humbling is that it's really happening at the planetary level, really across, in every country, in every land. This is really happening at that deep of a level. And I feel through intelligent design, really, we can reimagine what we're doing, what I'm calling sort of intentional and intelligent design. We can go through this in a way that we feel good, and that we feel more confident, and that we feel more comfortable, knowing that we're sort of in the land of uncertainty. There's a lot of uncertainty now. There will be a lot of uncertainty over the next year. And sort of living with that uncertainty, knowing it, recognizing it, and then working forward, and to feel like what can we do next? And two fundamental pieces in my view are knowledge, and knowledge is power. And so I want to share some information with you about at that level, which sort of addresses us at the intellectual cognitive level, but also a daily practice that again gives us the choice to how we respond in real time in the workplace, at home, with our family members, out in society, with our friends. And that requires a daily practice. So, and that sort of hits us at the heart level, you know, and at the wisdom level, so that we can cultivate some ability to choose. And a lot of this with respect to COVID-19 relates to, we talk about all this information about the virus and what does it do and how does it transmit and what can we do to treat it and how we can prevent it. The other big factors are the host and the environment. And as integrative health practitioners, we all know the importance of those aspects as well. And I want to give some voice to that. And that's been unfortunately very underserved in the media, and a lot of the news doesn't really talk about the host and how important it is that we stay healthy. You know, that our immune system is a function of our own vitality and our own health. And if we're not sleeping well, and we're not taking care of ourselves and exercising well and eating right, and doing all the things that I'll speak to in the back half that help us have a robust host, create a robust sort of environment for ourselves, that we're much more likely to become ill, regardless if it's COVID-19 or anything else, through contagion, as well as psychologically, and as well as sort of our general well-being, as well as our relationships. Like it affects it all. So how do we navigate some of these social and work environments? And all of us have been in the grocery store, and you know, I can recount stories of people, lots of events happening. There's lots of interactions, and there's a lot of anxiety, and so people bump into one another. Some people are taking longer to make their way through the store, and other people are sort of crashing into their carts, encouraging them to move along. And there's a lot of vigor. And so how do we navigate that, and including the workplace, now that we're sort of slowly figuring out how to get back to work? So I want to speak to some of this a little bit. And one of the you know, what's important to keep in mind is we're worried about contact, right? We're worried about fomites and landing on different places, our packages, our food. But the truth is the large preponderance of us are getting infected due to the environments that we're in. So, you know, whether it's meat packing plants, whether it's prisons, whether it's nursing homes, whether it's office spaces, or in our own home, if someone's infected in the home, that those are the places where things are happening. So it's real important to think about those spaces and to look at our own indoor ventilation systems. And how do we think about improving those? So what we do know for certain is that if you improve the ventilation system, looking at influenza alone, you could reduce influenza rates by 50%. So what does that look like? Opening windows, you know, is a cheap way to do it on one side of the house and the other, or doors, so that you get cross ventilation, and putting fans in place and HEPA filters. These are all allow for better flow if you can't redesign your HVAC system in whatever building you're in. And so I can't emphasize that enough, as well as being outdoors versus indoors. And we talk about social distancing, and that's quite relevant, but a big factor is if you're in a building, you might be in one part of an office building, and if the flow in that building isn't correct, you may be getting air funneled from another part of that building into your space. And so you just want to keep these in mind. We all know about washing hands and disinfecting, and this is all very important as well in another part of the conversation. And I'd like to speak a little bit about masks, and there's a lot of conversation about this, and we have our leadership, you know, talking out of both sides of their body parts. When you have Trump sitting there at Ford and the Ford plant, and going against the state laws that the governor put in place about wearing masks, let alone the Ford plant's own rules. And he stands there not wearing a mask. But we all know that masks help. And the question is, what mask is best? And do we need to wear a mask at all? There was initially a lot of conversation about that we don't need masks, but the truth is that was a politicized and policy-based conversation, not a science-based conversation. You may remember, unfortunately, our Surgeon General actually even said that in a tweet, that they don't provide any benefit thankfully, we have a lot more science to look at that. And I just want to speak to this a little bit. The picture on the left is UCSF, and they've implemented universal surgical mask precautions that people are wearing. Do you need to wear an N95 mask? The truth is that these N95 masks are really uncomfortable. If anyone's used them before, you know, wearing them all day is not easy, and getting them properly fitted is really important. And that seal across your nose and across your mouth and underneath your chin is really important. And they're quite uncomfortable, and they're hard to find, and they belong in the hands of healthcare workers that need them. So surgical masks are a great alternative to that. And you can see there's been lots of work done in this. And if you look at this paper that was published about a decade ago, you can see the intervention effectiveness of wearing an N95 mask. And this is, you know, in the hospital setting versus a surgical mask. There is clearly a difference, although other data has shown that there's no difference, but that depends on the environment. So the studies that have been looked at for ambulatory settings, for example, showed no difference in reducing influenza rates between surgical mask and N95. But if you're in the hospital setting where things are far more aerosolized and there's much more larger exposure, then there would be a difference. But for out in the community or in an ambulatory setting, a surgical mask is great. And you can see at the bottom, taking all these precautions in mind, you have 91% effectiveness. So what about sort of, you know, what do we tell our patients? How do we meander through society at large if we're not, you know, working in the clinical environment? Can we use a regular mask? And what does that look like? The homemade, you know, from t-shirts or tea-cloth. And you can see here that the real benefit we get when you're looking at the tea-cloth versus surgical mask, you can see on the incoming, protecting yourself, tea-cloth, you get 33 particles leaked through the mask. Surgical mask is a bit better, and the N95 is clearly much better, but much less practical. So there is some benefit of protection. And then the question is, how well do we protect others as well if you're infected? And you can see that as well, that you get some protection. But the truth is, if you're coughing, a lot of that material will come through that mask. Surgical masks are only half the amount of material. And so these are important things to keep in mind when we're thinking about the use of masks and why people need to use them. And then the question becomes, at what distance can you infect others, and what does that look like? Outdoors, obviously much less likely. And to really think about this, it's the number of particles we're affected by, how close we are to those particles, and the amount of time we're there. And so outdoors, someone's passing by, much less likely to get an infectious dose. And so, you know, to really just think through and keep in mind, yeah, we should be wearing masks, ideally surgical masks. They're not really accessible for the public, in which case you can make your own mask. People are manufacturing them, as you've seen them probably with coffee filters, which I haven't been able to find any studies on. We've seen them with vacuum cleaners, you know, vacuum bag filters, which actually are pretty effective, but they're really hard to breathe through. And so much less practical to use. So the other piece I want to sort of, now that we sort of talked a bit about environment, the rooms, you know, that we're in, how important those are, appropriate ventilation, wearing masks, how do you sort of navigate a workplace environment? And really, it's about being mindful, because a lot of we don't think, you know, if you go as a physician, when I was training and doing my surgical rotation, I remember I had to learn how to like be sterile, right? And how to put on all the stuff before going into the operating room. And you really had to think through all the steps or you contaminate yourself. And I can't tell you how often I see people contaminating themselves, you know? So there's a grocery worker, he's at the cash register, and you know, the mask is falling and he's touching the mask and putting it back on, and then scratching his head, and then touching, you know, check out the food. And then so a big piece of this is really being mindful, trying to slow ourselves down and doing the best we can. And then washing our hands a lot, so that when we realize, you know, I did it myself, I go to the market, wear a mask, touch some of the items, adjust my face mask, take it off when I get in the car and scratch my face. It was like, okay, well, I just blew that, you know? So, okay, then we get some disinfectant and put it on my hands. Like we just need to slow down a little bit. It's a big piece of the puzzle, is to try and slow ourselves down. And, you know, in thinking about that, I sort of want to speak to the next part of the equation, which, you know, Lancet has given some sort of platform around, which is around our own mental health. And, you know, if they want to research it, I want to help people, and including myself, gain more sanity and slow ourselves down. And this goes back to sort of the reimagining opportunity here. It's the beautiful thing about this pause is that we have an opportunity to reimagine how we want to live our life and to be intentional in how we put the pieces back together in our life. And how much do you want to consume of goods and products, and how fast do you really want to run? And what are the things that are important to you and less important to you? And maybe we don't have to do all 150 things. We can pare it down and do 90. And so I feel like there's really a huge opportunity for us. And part of it is thinking through about the level of stimulus that's coming in. And we all know that, you know, the study of hormesis, where you have a little bit of stress that's put on the system, and that allows our system to grow, right? We get exposed as kids to microorganisms and these small little infections we get as we're growing up, and that allows our immune system to become much more robust. And similarly, challenges, you know, academically and sort of intellectually and physically, these all allow us to grow. And the question is when it becomes too much. And right now, there's a lot of too much as it relates to the emotion of fear. And, you know, thankfully, for many of us, we're on the backside of this wave that was coming through, and we're in between waves, although there's some areas that aren't. But for the most part, we have the opportunity to reflect and to regroup and to ground ourselves. And for some of us that were sort of redlining it, I know I was for the first month before the wave came, and as the wave was coming, I had no idea how big it was going to be and how bad it was going to be. And I was really working 18-hour days preparing to care for my patients, right? And to care for my family and my loved ones and my friends. And now I did hit a wall, and I was, you know, exhausted, and you know, at mid 50, I'm not in my mid 30s. I don't have the resiliency I had back then. And so I had to regroup and really find a new rhythm. And that was, it was intentional. You know, I had to really intentionally do that, because otherwise I would just be in my automaticities and just keep doing what I was doing. So how do we move ourselves back to sort of that yellow zone? And it's hard. You know, it's hard because many of us really love the adrenaline that we get from getting a lot of work done and stuff that is meaningful for us, that we can have a big impact in the world or in our community. And yet at some point we can start to teeter or moves into that exhaustion mode, and then we lose sight, and then we get potentially sick, you know, at multiple different levels. So the thinking, you know, and you've seen this at different time points, and Yerkes-Dodson's law is sort of pretty classic for this, which is there's a sweet spot, and for each of us, we're different, and we have our own sweet spots, and it's important to find that sweet spot for yourself. And that goes back to that practice, that daily practice of just checking in, even for 5 minutes, to check in and see how you're feeling, how your dreams were, what are your goals for the day, how's your energy level. That check-in will allow you to regulate how much energy you put out into the world, and then allow you to stay in that sweet spot where your concentration, your decision-making, and your immunity are all at its peak. A lot of us are running these internal narratives, and that's really what this graph is about, is the person in blue where, you know, someone cut you off on the road, or I had an event that happened this morning. So I went to go for a hike and I was looking to park and I was going 5 miles an hour on this small little road. And some woman who was walking her dog yelled at me and said, you know, slow down, asshole. And I was like, whoa. I literally was going 5 miles an hour. And I had an immediate response and I had to check that response and be like, wait, this woman is really suffering. Like that's such an aggressive response. And to sit there for a moment and say, you know, I'm sorry, didn't mean to scare you. Hope you're having a better day. And I'm sorry, things are challenging right now. She didn't respond well to that either, but you know, at least I did my part. And then the question was, how long am I going to continue to have that narrative in my head? And so it had left until now and bring it up again. So I'm in the blue zone right now, reliving an event that happened in the past, right? So, you know, the challenge happens, it's over in this recovery mode, and the people in red on this graph are, their physiologic responses calm down, they've moved on. And those in the blue are still reliving it. And me telling you the story right now, my heart rate came up, but you know, I'm reliving it, right? So our ability to move to this adaptive stress response requires a daily practice. And that's what allows us to really get there. And that will allow us to move, to create space and some pause between the events that are coming at us and our ability to respond. Because we have, as many of you know, the fast twitch system and the slow twitch system. And the cerebral cortex, the sort of more wise and contemplative approach, particularly our prefrontal cortex, that allows us to reason and choose a wise path, works a bit slower than the quick emotional limbic system that has an immediate hit. And so we need to create space there to allow our slow twitch response, a neural network, to catch up and do the right thing. And that requires, back to, you know, the mantra of the hour here, us to slow down and take it a little bit easier on ourselves. And in that process, we can allow, what tends to happen is more stress, we can handle more stress and not really be affected by it in the same way and still be able to stay in that thriving mode and not that survival mode. And that's really the key that I want us to sort of, you know, give some love and attention to today, is finding a path for ourselves to think about, even just imagine, what does it mean to start thriving? Like, many of us have not been in that mindset at all. Maybe we used to be, and now we're shifted into this like survival mode, right? And so at least give yourself 5 minutes a day to imagine that and to move towards that. By doing that, it creates a muscle response internally in a neural network that starts to develop that allows you to go there easier rather than not. And there's lots of research looking at it through meditation practice, showing what we call the default mode network, which is that narrative network that allows us to ruminate and keep us in that blue mode where we have this high physiologic response, even though the event's already happened in the past. We're still thinking about it and ruminating on it. This meditation practice has been shown to deactivate that and make us much more present, or at least it lasts for a much shorter period of time. So what I'd like to do is just take a moment while we have it and do such practice. So if you would, let's give ourselves 5 minutes to uncross our legs and sort of get ourselves comfortable, and cross our hands, and if they're crossed, and if we're sitting a bit like this, we could sort of relax a little bit and allow ourselves to be comfortable for a moment. And if you're leaning up against a chair, if you're physically able, I would sort of scoot up a little bit towards the end of the chair so you're not resting against a chair, or you can sit on the ground, whatever feels comfortable, or on the edge of a couch. And just let your hands rest on your legs. Maybe put one hand on your belly, over your belly button, and just notice your breathing. Sometimes it's easier to close our eyes, and for some people, they prefer to leave their eyes open. For me, when I close my eyes, my mind tends to become more active. And one of the things that a lot of people sort of react to around meditation is they say, I can't stop my mind. It's always thinking. I suck at this. I'm a bad meditator. And the truth is that the nature of mind is to continue to be thinking, and it's sort of the monkey on the back. It keeps jumping around and hopping around, and that's okay. That is the nature of our mind. And the wisdom we gain from a meditation practice is that we learn to separate that thinking from who we are, and that it doesn't become us. We learn to unravel that tight weave so that we can observe our thoughts and emotions rather than be enmeshed and immersed in them. And that gives us choice. That empowers us. And it's a lesson and a teacher every time. So if we go back to our breath and then find ourselves thinking, just simply come that moment when you realize you're thinking, and this is the moment that you're separating you from your thoughts or emotions. And it's a beautiful thing. And then just come back to your breath again. I like to suggest that people prolong their exhalation if they can, gently. A little bit longer than their inhalation. Maybe it's a 3 count in and a 4 or 5 count out. That prolonged exhalation helps activate our parasympathetic nervous system through our vagus nerve and our diaphragm, and helps calm our system down. And maybe place your other hand, if you feel comfortable, over your chest, over your heart. And take a moment just to feel the gratitude of the beauty of being alive today, of having your health, of taking the time out to take care of yourself by joining us today in this wellness webinar. And just take in all the love that's out there. Maybe think of a loved one who, when they shine their gaze on you, warms your heart. As practitioners, we're always putting so much energy out to the world. And just to take a moment to bring some back in, to absorb that love, that appreciation for the work you do. And then just coming back to your breath again. Noticing the inhalation, the transition from your inhalation into the exhalation and back, that transition moment. And when you're ready, you can open your eyes if they're closed, wiggle those fingers and toes, and bring your mind back into your physical body and into the room. Welcome back. It's amazing where you can go in 5 minutes.
Yeah, that was really, really great, Brad. Thank you. Just interjecting that in the middle too of the presentation was really nice.
It's nice to take a pause every once in a while. So I'd like to just share a few more slides, and then, if there are questions, please have them float through. I love this slide because it makes me laugh, and it makes me cry at the same time. This is sort of where we're at, and as many of you probably know, with respect to COVID, being all the health issues that come along with our gluttonous lifestyle has really made people much sicker, and has really dramatically increases people's risk of badness, morbidity and mortality. And so I know a lot of us working from home, we're near our kitchens, we're snacking all day, it's really easy to gain weight. And I know a lot of people have gained weight during this time. And even if they're sort of exercising and finding time to do other things, but the food's just always around. So just to taking a moment to sort of remind ourselves to reflect on our nutrition and how important that is, and how our host, back to what I was saying in the beginning, that we want to care for this host that we embody so that we can live in a really much more of a prosperous manner in the current times, as well as the times in our future. And I always love to tell people, if there's no ingredients on the package, or if there is no package, odds are it's really healthy. So walk into a produce aisle and there's never an ingredient list, because it is what it is. Makes life simple. The other piece is just, around exercise and the importance of exercise for our mental health as well. So much of our mental health can be, right-sided when you go out for a run, or you go for a bike ride, or you go for a walk, and whatever it is that you like to do, whether it's yoga or whatever it might be. And we don't need as much as we think we need. And even 20 minutes gives you 2/3 of the cardiovascular benefit, and Lord knows it gives us a lot of mental health benefit too. So I just welcome that as a daily dose. And relationships, and how do we reimagine our ability to relate to others? And what's been interesting, and I know several people that are doing this now, is people sort of, I'm meeting now over Zoom with my high school friends. I'm sort of, it's often over drinks, but whatever it might be, or it's, with college friends, or it's my friends from this time in my life. And that's been a beautiful thing. And I think finding more creative ways to do that, now with the weather that it is, being outdoors and with neighborhood gatherings, done with, mindful, intelligent, intentional design, people socially distance, people wearing masks if they feel they need to, just doing it the right way, but to come back to community. Maybe we can come back to our neighborhoods, maybe we can come back to our homes, and we can reconnect with people that are geographically dispersed from us. And I can't overemphasize nature, Mother Nature, and what a container Mother Nature is. We're fortunate here. I'm in the Bay Area, and I live at the foot of Mount Tam, and I have trails that I access regularly. It's harder for some some folks, depending on where we live, but to get a daily dose of nature, go up and hug a tree. We're allowed to hug trees. We will not infect them, and they will not infect us other than with goodness. So I highly encourage hugging trees. There's really, beautiful sense of comfort and well-being that comes from that. And then back to purpose. And I feel that now back to sort of reimagining what's possible, to think about what is possible. Where is your purpose? Now that it's interesting, there's a lot of people that have their to-do list. They've been going through things that they haven't been able to do forever. And now some things rise that are on that to-do list and they realize I have time, but I still don't want to do it. It can be really a clarifying time for us to find that clarification around what is it that we want to do? How is it that we want to spend our time if we have that extra time? So I welcome, the opportunity to sort of entertain questions and people to raise their own concerns or contribute to the conversation. So maybe we can take a few minutes. I'm fortunate enough to be able to work here, although this place is currently closed because it's in the national park. And so we're sort of invested in there. And I try to make my practice sort of walk my talk in that as much as I can, I try and take people on walks during visits if I have the opportunity to do that, and bring people, into nature by bringing nature to my practice. So I encourage you to be creative in your own ways and how you want to practice as well.
You can unshare if you want, Brad.
Yeah.
Great. So first of all, I just really want to thank you for that presentation, Brad. And we do have a few questions, and also just want to, the reminder for all of us to just take that time, even if it's a few minutes in the middle of the day, at the beginning of the day, at the end of the day. I've found that has become an essential component to do with my family, and really engaging the kids and the whole family in that conversation, because like you said, regarding, just how different people are being triggered, and that dynamic of even going out a little bit into the world. We had a recent incident as well in our neighborhood where, someone tried to, I wouldn't say run someone down, but like they didn't have masks on. And so it was all over next door, and, the kids hear about it. And so just really trying to find that space that we all take as a family to both kind of process those little things so that they don't keep replaying, but also take the moment to be calm. And we've been doing a lot of meditation, and some of you have seen the earth walking, and my daughter's been doing some of the meditations for us each week. So those things, they might seem really simple, but I feel like that is really such a big part of how we can help manage all of this, both personally and then in our with our patients in clinics and with our communities.
Abby, do you does your family lead a practice with one another? Do you guys come together, and the kids? I know your daughter's led meditation for us.
We do, everyone, we do different things. We haven't been successful in all doing it together. There's a little bit of resistance to that.
Yeah.
But I will say that what has been an essential piece that you also brought up was the nature piece. And we, when the state parks were shut down here, that was really hard for us because we have trails that are close to our house that we were accessing, and that was really helping managing everyone's stress. But we do have a big garden, and I've noticed more and more that just the kids tend to find their way to the garden when they've been stressed. And then they just are out there, and they're just kind of barefoot and connecting, you know, doing whatever in the garden. And that's become their practice almost, right? My children are in elementary school, so sometimes trying to say, okay, we're all going to sit and meditate doesn't necessarily go over, you know, in the best way. Sometimes it's fine, but I've found that just trying to figure out ways that they can connect to that thing that helps calm them more naturally has been helpful. I don't know how you guys have managed this as a family, but.
Yeah, you know, we're all doing our own things. It's interesting. My son has started doing meditation and yoga on his own, and you know, he sees us doing these things. So whenever we try, I have a 16 and 14-year-old. Whenever I try to direct them, they,
Yeah.
by definition, they're trying to define their own self, and so it's an expected response. So that's been interesting to do, but it might be worth now that you bring it up, seeing if they can re-engage.
So we have a couple of questions I thought we could take. We have one coming in from Jacqueline Gadbaugh. She asks, can you comment on your recommended protocol for groceries? Should I be disinfecting them? Can I just let it go?
Yeah, so it's unclear. So the data, the CDC has sort of said you can, let's let it go. But unfortunately for the CDC, I'm never clear what's policy and what's science motivated. In general, most infections are thought to, like I said, come from environment and transmission sort of through air in closed environments in particular. So the only scenarios that really make sense are, you know, infected person touches something, you immediately touch that, and then you touch your face. So, you know, and then, so that's the scenario. I've still been doing it. So I've still been putting stuff in an area that sort of contain it. Stuff we want to immediately use, we wipe it down and then bring it in the house. We used to be much more vigilant about it. We've relaxed it a bit because I do think the risk is pretty low. And if you let it sit for a day or 2 days, clearly it's fine. Stuff that can't sit, then we still wipe it down. With that said, I think the risk is very low.
Great. We have another just kind of along that same lines. Rita Steck is asking, are face shields better than face masks in your opinion?
No. So face shields are good for coming into the eyes. So they protect the eyes. Now they do wear face shields, which is another layer of protection. You know, you have a mask underneath the face shield, but they're good for the eyes. And then they do provide, you know, a blast blockage. But remember, the face shields have an opening underneath, so you're still breathing things through. So you still want a mask.
Great. We have another question coming in from Lena Bautista, and it looks like she's out of Boston, and she's just working with underserved populations and asking about, you know, for those docs who are working with patients in poverty, prisons, et cetera, who might not be able to afford, you know, supplements, organic food, those types of things. You know, what recommendations do you have? She also says, for people that are living ill with COVID-19, what kind of mindfulness do you offer? The easiest to her seems like prayer. It's hard to meditate when breathing is hard for active COVID patients. Still very important to decrease the sympathetic tone that comes from, you know, that fear. So any ideas or suggestions around those questions?
Yeah, those are all great questions. You know, you don't, I think it's a fallacy that you have to have money in order to live healthy. You know, you can live on rice and beans and vegetables and actually be healthy. And a lot of it comes with lifestyle. You know, there are some safety concerns. Can you be outside in your neighborhood and exercise? Is it safe? But assuming there's a way to navigate that and being outdoors, B, you know, exercising, eating well, which just means avoiding the processed foods, fast foods, etc. But, you know, simple foods like rice and beans and vegetables are healthy living. It's just a quantity issue. And then the mind and relationships and purpose, do so much to move us from surviving to thriving. And what I meant to speak to, which I didn't in the last slide, was really around service, and our ability to help others really puts us into a different mindset and makes us feel so much better about ourselves, so we don't beat ourselves up. So service is a huge piece of that. So I do find that there's things that don't cost anything, that are easily accessible. Prayer might be, a nice way for some people if they resonate with that, and others don't. And so just a breathing practice, just being in relationship with others, resolving issues amongst, tension amongst other colleagues that you've had, or friends, loved ones. All these simple things can really help people, and help optimize people's immune system as well. With respect to breathing and sort of meditation and people that are acutely ill, again, bringing someone's attention, there is a layer of anxiety that happens when you're dyspneic, when you're having difficulty getting enough oxygen. And so to be able to drop into that and try and slow the breath, it's all relative, right? So if you're breathing more quickly, it's really about just being mindful about your breath. You don't even have to slow the breath. It's just being mindful of your breath. And if breath isn't the right thing to use as your guiding post because you're breathing quickly, you move into a different place. Anywhere in your body is fine, just to get yourself out of your head. That's the intention. So some people, use beads and they sit there and count the beads, right? Some people use a flame and look at a flame. So some people check in and feel their heart, or feel another part of the body where they hold tension. So there's lots of places to give your focus to.
Yeah, I would agree. And I'd also add, because, with children, quieting a mind is not necessarily an easy thing to do, or even conversation to have, right? And so we actually find that using visualization techniques are more effective. If my kids can visualize something that's super peaceful, then the breath follows. If I ask them to concentrate on their breath, they start asking questions like, what do you mean? Why do I have to do that? What does it feel like? Instead of just going, okay, can you picture something that is really peaceful to you? And so that's again, another kind of technique. If you can't physically breathe well and that just causes you more stress, then, don't do that, right? Don't concentrate on that aspect. Like Brad was saying, find something else that you can kind of that helps you calm. I've also found that this can happen through any of the senses. So smell, sometimes using an essential oil or something that just, if it's roses that connects you to that thing that's very peaceful and relaxing, like that too can just inadvertently bring you back to the breath without having to focus on that. So
yeah, and much of the exercises, to your point, is really just about us stepping away from our active mind. And so, not actively, when you try and actively quiet the mind, it wants to rebel. So if you just redirect your focus onto something else, then that the active mind moves to the background, and there's great sort of luxury and peace that comes from that.
One more question before we have to wrap it up. Lena also asks just around if there are cheap foods that can help increase glutathione or do other things that can be replaced in populations that maybe can't afford some of the supplements. And I would also come back to what Brad was saying before. I worked in Nicaragua for almost 10 years, mostly with campesino farmer populations. And what we found was not necessarily, again, the access to healthy food is there. It might be the choices, and really just even talking about, like, why don't you eat, there are raw vegetables, like, eat a raw piece of broccoli or a celery stick instead of choosing to have a bottle of Coca-Cola in the refrigerator, whatever. So even more so, it's like, what types of choices could be replaced that are just healthier choices? And what I find is anything around whole food is better than a choice that's not, and to just take small steps in that instead of really, you know, getting too complicated with it, because each person's going to have access to something different, you know, or not have access to, you know, say a food that's high in glutathione or whatnot. So
Yeah, and I tend to, back to the ingredient list, it's like if there's no ingredient list, that's a good sign. And if the ingredient list is less than 5 items, and for the most part you can pronounce them, then the odds are it's a healthy food. And to your, you know, the question that was asked and alluded to around onions with quercetin, like, yes, all the vegetables and all the herbs and spices you can put into your food, the better.
So Brad, do you have any final thoughts or comments you'd like to share with people?
I think the main reflection is this is an opportunity for us as an integrative health community to come together, and I encourage us to do so, whether it's in our local chapters through the Academy or it's through these wellness webinars and other creative ways. And I welcome sort of feedback for everyone that's watching this to give us at the Academy, you know, of ideas for ways that we can bring each other together, whether it locally, geographically, or nationally across or internationally, since we are a large community. I think it's a time to reimagine how we want to be in the world, and there's no better way to do that than to come together in the community.
Great. Thank you so much. I'll
Thanks
just say, you know, next week we are continuing to do all of these webinars. They're all free. You can come and watch them again on Facebook or on YouTube. Next week we'll have our Monday meditation, and we'll also have a Friday wellness webinar with Jacqueline Chassie and Tom Blue, and they'll be talking about lessons for building a COVID era practice. So if you are interested in that, please come, and we'll look forward to seeing you online and on Zoom and in our virtual and hopefully soon live communities. So thanks again, Dr. Bradley Jacobs, for being with us today. And I just wish all of you a wonderful long holiday weekend. Please enjoy Memorial Day in whatever way that you can, and be safe and healthy. We'll talk to you all soon.